Okay, so now what we want to do is to show some integration movement. So as you've done some soft tissue release work, some scar tissue release, we want to now integrate. So it's like when you have a really tight muscle and you've had it worked on, and then you want to help realign the fibers so that everything folds. So we're doing the same thing with the tissue release. Now we're actually going to encourage that integration of the tissues to hold the improvement that you've done to it. So first one we're going to show is diaphragm breathing, which is going to set your core. That is the basic foundational exercise we want to do so that everything, that core gets set. So it's going to help the diaphragm, the pelvic floor, and the intrinsic deep muscles of the abdomen be able to set that stable core, and then we can add movements on top of that. So what we're going to do is we're going to lay on our back. Then we're going to have one hand on our chest and one on our belly, and we're going to take a deep breath in, let belly rise, belly falls, and then everything kind of contracts like you're tightening up a corset. From there, we're going to elevate our legs and our arms. What we want to do from there is now we're going to stress the core a little bit, so we're challenging it by moving our extremities. So we're going to do one arm, one leg, and one leg. Now again, if you feel like your lower back starts to pop up, or you see that coning and doming start to happen, or you get pain, you're going to stop and reset, do that diaphragm breath, and then bring your legs and your arms up again. Now, another variation of these exercises, depending on what stage you're at, you can do a wall plank. Now, I'm going to do it from my knees so that you can see, but what we're going to do is we're going to lean against the wall. You're going to take a deep diaphragm breath in and out. And then you're just going to take one hand off and do a shoulder tap. Now, if that is really easy for you, you can start to come down into an incline. You can go down to your coffee table, you can go down to your couch, or you can come to the floor. Now, I'm going to show you from your knees. Again, you're going to take a deep breath in, all the way out, hold that. And then what you want to do is you're going to tap your shoulders. So you're going to feel your core be able to activate every time you start to lift one of those arms. So you want to be able to hold your body stable so that you're not really shifting from side to side. So I really encourage you to splay out your hands, have your elbows, decreasing your elbows facing each other, and making sure that you are putting body weight and stability into every single knuckle of your hand. So you want to make sure, especially your pointer finger and your thumb are glued to the floor. And then you can start your motions. Good. Another one you can do is to sit and take a weight, something heavy. Do that core breath first. Set that, hold it, and then you bring it around. And all you're doing is you're just trying to hold that core stable as you challenge it in all different directions. And you can go around to this side too. All right, so I would encourage you to start with whatever exercise you think you are at. So being able to do something that is non-weight bearing, doing the dead bug, I would start with that if you're closest to having had your surgery. You can then increase the intensity as however farther out it has been since your surgery.